So welcome to the Cancer Support Community's What's in Your First Aid Kit series. I'm Susan Ashley. I'm the Vice President of Education and Programs at the Cancer Support Community. We are a global nonprofit network of over 175 locations, including the Cancer Support Community and Gilda's Club partnerships that deliver more than 50 million in free support and navigation services to patients and families. We administer a toll-free helpline and produce educational and digital resources that reach more than 1 million people each year. We also conduct cutting-edge research on the emotional, psychological, and financial journey of cancer patients and caregivers, and advocate at all levels of government for policies to help individuals whose lives have been disrupted by cancer. Our belief that community is stronger than cancer is what led us to create this workshop series for oncology professionals. We recognize that you, the cancer support community, the hospitals, and cancer care clinics are on the front lines of cancer care. The care you provide impacts cancer patients, survivors, caregivers, and your colleagues from the moment of diagnosis and through the end of life. We want to thank you for your commitment, your passion, and for your compassionate expertise. It is my great pleasure to introduce our presenter and my friend and colleague, Dr. Timothy Seay-Morrison. As the Executive Director of Ambulatory Care and Service Lines, Dr. Seay-Morrison leads the strategic, business, clinical, and operational functions for Stanford Healthcare Service Lines. He provides oversight and leadership for workforce health and wellness, primary care, medical specialties, palliative care, and geriatrics, dermatology, allergy and pulmonology, and psychiatry and behavioral health sciences. And yet here he is with us today, even with his busy schedule. During the pandemic, Tim led Stanford Healthcare's ambulatory response to COVID-19 adaptations, community testing and vaccine operations, and the Stanford Medicine Healthcare Workforce Response Team, which managed the COVID-19 occupational health needs for the health system. He previously led the clinical support services and patient care service teams in the Office of Chief Nursing Officer. Prior to joining Stanford, Timothy was the care coordination manager for surgery and transplant at Ronald Reagan UCLA Medical Center, and he also held clinical instructor faculty appointments at the UCLA School of Public Affairs and the UCLA LA David Geffen School of Medicine. Tim is a licensed clinical social worker, an accredited case manager, and he has a doctorate in education and organizational change and leadership from the University of Southern California, where his dissertation, Retention Rates and Burnout Among Medical Assistants, was awarded distinction by the Rossier School of Education. He also has a Bachelor of Music degree from the University of Miami and a Master of Social Welfare degree from UCLA. Tim lives in San Francisco with his husband, Ben, and their 2 children, Arthur and Henry. Tim, I couldn't be more excited to learn from you today.
Thanks, Susan. And hello, everybody. So nice to be here with you today. I'm gonna test my share screen one more time with Susan and Kara, make sure we're ready to go. Great, but I need to see my own. Awesome. Thank you for that lovely introduction. Susan is a colleague and friend, and I'm honored to be asked to be here with you today. So I think I don't have to do this part because I think Susan shared this piece already. And this is our title today. I'll come back to that in just a moment. And you can see my disclosure. The first thing I just want to tell you all, it's a really packed agenda. We're going to move super fast, take a lot of notes, and don't ask questions until the end. I don't really mean that. Let's take 1 second, actually. And this is how I'd like to start with all of you, if you don't mind. if we could just start today by thinking first about some deep breathing. We'll do 5 breaths with 5 in and 5 out, and I'll help you count through it. So in through your nose, 1, 2, 3, 4, 5, and then out. 1, 2, 3, 4, 5. Number 2. And out. Number 4. And the last one. And out. Thank you for starting that way. One thing I became very aware of during the pandemic and being on so many Zoom meetings was our quick dive into everything without a chance to center ourselves and moving from one thing to another. And so one area of my own sort of health and resilience building was being able to just stop for a second and collect the group that's meeting together in some community fashion. So thank you for doing that. I'll go back just a second. Susan introduced me. Gosh, it sounds like so much on paper. That's so funny. I'm humbled and really grateful to be at this place in my career and to be here at Stanford. We can talk more about that another time. I thought about my headshot for this picture and for today, and decided to use a picture of me and my kids as a journey and a place I'm on, and sort of like reframing being a whole professional and this sort of work-life integration that exists, and really trying to check myself and leading with that as myself as a person before my work in a lot of ways. And I'm going to talk a little bit more about that. I titled today's presentation Lean Through, Staying Resilient and Engaged as Leaders of the Healthcare Workforce, again, because of my thoughts, especially about the last couple of years. We like lean in, and how far can you lean in before you fall over into the kinds of things that we've been asked to do, but knowing that we have to get all the way through. And so making it to the other side, whatever that means, is where I wanted to sort of frame ourselves with our conversation today. There's my disclosure. We did our getting started just now. Thank you for breathing. We're going to talk a little bit about the situation we're all in, who we are as people in a system, and then the leadership challenge, and some, hopefully some time together to hear from you a little bit more as well. So first, I got to see this movie, Don't Look Up, last weekend, and I was like, oh my gosh, totally, what more could happen in our world in the last couple of years? Just everything that comes to mind that has gone on. Could there possibly be a comet hurling toward us as well? I don't even want to look up because I'm afraid of what might possibly be heading our direction. And it's just been such a challenging time for everyone in life, right? And so I share that with all of you, knowing everyone's been through so many different things together, separately, and it has felt like everything's been on fire, literally, right? It's hard to remember, but right around the beginning of the pandemic, Australia completely burned down. We had the largest fires in California. and Colorado and the West Coast we've ever had in the last year. And then just the amount of stress and other fires that we've been putting out personally or in our workplaces, and also just in our political world and community too. So many opportunities and stressors on us as a nation and as a community of people. I just snipped super quickly from a couple of places on a Google News search about the burnout language, right? I mean, everyone's burned out. We know that. We know in healthcare, caregivers are burned out. Their empathy is declining. Yeah, I think the New York Times shared a recent story about healthcare workers have no more empathy for unvaccinated people they're caring for. And so this challenge we've all been in. Well, I mean, I'm burned out too. Gosh, I'm sure all of you are. Not only are the frontline caregivers we care deeply about and want to support have been faced with so much stress and trauma at the front line, they're also relying on their leaders to support them and what we can give them in terms of helping them stay focused and buffered through all of these really challenging things. But the leaders have gotten burned out too. We haven't talked about that very much. Perhaps it's not very nice as leaders to talk about our own burnout in this work, but I think it's true. And from my colleagues and from what we see, it's just been hard on everyone. And the pain of caregiving and that stress extends to the leaders who care very deeply for their team members. So I'd like to test this out with you. If you've done Poll Everywhere before, there's 2 ways you can do this. Join by web, enter that. You can send a text message. And if you would answer this first question, beyond COVID and work, what other stressful events have you experienced in the last 2 years? It'll be anonymous, we won't see your name, but if you might populate, what's been going on for you? See if it starts to work. Anybody made a response? Let's see if I can get this. There it is. Awesome. Keep going. Can you see it now too, Kara? It's so hard not to see any of you.
Yes, we can see it.
Thank you. Like presenting in a vacuum, right? Yeah. Look what's going on just in everybody's individual lives, right? COVID was rough. You had to work a lot. Everybody got changing algorithms and protocols every single day. But at the same time, everyone's a person that has all of these things going on in life too. I see death is a big one. Gosh, talk about the major life stressors, and for that one to be the largest word in our word cloud today. Changing jobs, moving, buying houses. So much unprecedented stress on our lives. Thanks for sharing that. I'll keep it there. Oh, it's full. It's no longer accepting responses. Oh, who knew? Looks like it's still popping around. That's okay. We'll go back on. We'll minimize that part. Sorry. Great. Well, Didn't work, Kara. My fancy sharing didn't work. So I'm just gonna go back to doing it as normal. Just trying. How's that? Regular view?
Yeah, when you shared your slide, Tim, we could see it just fine.
Great. Regular slide now, Susan, sorry.
Perfect.
Okay, sorry about that, everybody. So thank you for sharing your personal stressors that have gone on. When I was preparing this presentation, it's funny, in my normal course, I put myself in the like, oh, I want to talk first about the very experiences of what we do in the workplace to build our resiliency as leaders. And then I had placed my sort of family and personal component at the end. So again, in this sort of personal challenge around how do we stay true to who we are as people first, as leaders, I forced myself, I had to reorder myself as this as well. This is my family celebrating my dad's 70th birthday. He has my two little people in his lap up there. My mom is next to him. As a family, we unfortunately dealt with lung cancer for the last 2 years. My mom died in December of this year. And this is a great opportunity we all had together. There's plenty of joy and sadness at the same time in our lives, much like all of you. So this is who we are as people. And I share about bringing to this place of starting first with who we are. And I like to return to my social work roots when I think about the components of teaching. I get super excited when social work theory or anything comes into the applications of work. But my first learning about building my resilience as a leader has been that codependency check, right? So how are my emotions and actions being impacted by others, or what am I doing in reaction to other people's things? And so why would I put my family later in a work situation? Who am I reacting to and responding to? And so my first reflection and offering to all of you is, as it's getting stressful and we're thinking about how do we survive at work, is checking what about my work experience or as a leader is really about some areas of codependency. We love codependency as social work. Actually, there's a lot of great traits, positive things that are in that codependent sphere. But when it starts to impact our own self-care and wellness, then we've got problematic behavior. So that check. And the second one has been around boundaries, really appropriate boundaries of this work-life balance, integration. What does that mean? But what's my actual relationship? How far do I go in my day-to-day life to provide what I want to provide at work? Where is that place? How many hours into the evening are you accepting calls? Still working at which time? How is that impacting you and your family? After sort of I don't even know, several months of feeling in that COVID adrenaline rush and not having terrible boundaries really, and feeling that gosh, what is a boundary I can take? And so I ended up just buying another phone, a personal phone. And for years, I've seen people separate their work and personal phone numbers and thought, oh, carrying two phones around, what a pain, or this or that. I can sort of manage these components. But the overwhelm of people being able to access you all the time, and I don't do CPR, so no one needs me to react that quickly. How do I set up a healthy boundary that lets me walk away from something, but I want to make sure I'm available for friends and family? And so, that first night that I walked away from my phone, left it on the counter in the bedroom, in the kitchen or whatever, and didn't look at it, was certainly took some behavior change and response for myself. But one boundary that I could sort of place into my life to think about, in order for me to survive this as a leader, there's got to be like some hours that I'm not pinged with thoughts of what I could be doing better at work. And then sort of the last thing about as an individual person, we're going to talk about leaders as people, leaders in a system, and then things we do at work concretely. But, you know, as a person first, again, was stepping back to recognize what is happening right now and how do I recognize which transference and countertransference I might be experiencing. And for me, super sort of tangible is, as I started the meeting, with these meetings that are frenzied and there's this hopping from thing to thing and everyone sort of needing an answer right now, and just wondering what about that is just someone else's anxiety and isn't actually a necessity or a driver that needs to be handled right now. And how do I react, not in sort of taking that on and something I need to do, but perhaps first responding and understanding that some of this is about anxiety and not about work performance. And then, right, my own countertransference. What do I place on needing approval in somebody else? Or why am I sort of spinning at this pace when the issue is perhaps my own sort of desire to be well regarded or care for somebody or look like I know what I'm doing or hide my own anxiety, right? Whatever it is. So this sort of stepping back and recognizing all that frenzy might not be a criticism of work or performance, but is perhaps someone else's anxiety or my own anxiety. And where do we bucket that and place that so then we can focus on the real work? So I share that also as these three components, which as individuals, as leaders, as the person that we bring to work every day, the things that I think set us up for some good resiliency. We're going to do one more poll everywhere. If you see this one, and I will share my other screen in 1 second so we can see your answers. How's that? What personal resiliency task did you put in place? You can put them in the chat too if you feel like that's easier. Focus on something pleasant. Thanks for saying that, Vera. Oh, somebody said the show Cheer, which I understand has a good follow-up on like how hard it was on those people to actually make that movie. I mean, that docuseries. TikTok, that's a good rabbit hole to go down. Yeah. Lost hours of life there too. Great. Thank you, everybody, for sharing those things that we can do together. I'll go back to my PowerPoint. All right, so my recommendation is that you never try to share multiple screens during your presentation. That's my new wellness check for all of you. So as I talked about sort of the geeky nature of our theory and what that we do and things that we do, is recognizing right leaders are actually people in the environment. So we operate in a system. I'm sure all of you think about where how the systems theory and the ecological system relates to you in your workplace. Which part of the microsystem are you in? How does policy sort of press down on us, et cetera? But just reframing, right? It isn't just being at work. There is a system of things happening, and each circle of those systems is also impacted, right, by all the things going on within its circle. And so my thoughts about then operating in the system, which in workplaces can be very complex systems with many interactions between different levels of the system, is first understanding, who am I in the system? Which part of role clarity, where am I in this system? It isn't like my family where I know I'm the son of this person and I'm the father of these two, but in the complexity of a system, where am I in it, right? Which part of the system do I operate in? So in that role clarity, and what I mean by role clarity is, first, I'll check my transference again, and assume that people have benign intent when there's too many cooks in the kitchen. It's one of my triggers, redundant or parallel work. So, but I'll assume it's all good intent, right? First of all. And then secondly, checking my own ego, as I mentioned. I don't have to save everything each time. But in lean methods, we call it, pulling the and-on cord. You might have heard this one. You stop the line, you stop and reassess, whatever it is, but encouraging that in terms of role clarity, speaking up, so important. I found this inability for folks feeling like they're tired, they're working so hard on something someone else is, not understanding role clarity, constantly sort of battling the role confusion. And we just have to stop for X period of time and go back and say, wait, who's supposed to do what? Which part of my job is mine? And my job's morphed, the pandemic, Susan mentioned too, I took on a lot of pandemic work, as many of you probably did. None of that was like in our job descriptions, but it took a lot of checking. Should I really be figuring out how many swabs exist in the marketplace? I don't know. Is that maybe it is today, but checking through so that I'm not stepping on supply chains, whatever, nursing director. Something some people use in terms of just role clarity is around, it's something called RACI. Maybe you've heard this. There are plenty of sort of methods, but I like to share this one, and especially because I like the Lord of the Rings ideas around it when you're teaching this to somebody else. But making sure we decide, if I'm Frodo, what's my job? I don't get to decide alone what to do with the ring. I consult on that. Gandalf is actually the person who ultimately makes the decision, right? And can I help myself and my team understand what we're all doing so that we make sure no one is getting burned out or tired from doing someone else's job, or feeling like they've done a lot of work when someone else was doing it too. What a terrible way to land is, I've been doing all this and it turns out Sam was doing it too. So sharing that as a tool. And then finally, the next thing I wanted to talk about is the leadership challenge. I'm a big fan, and Susan, thank you for bearing with me. I love this content. The Kouzes and Posner focus on the leadership challenge is really what I believe being a leader means, that these pieces of the pie are the things we put together, and they are the challenge to balance all of these components of the pie to be good leaders. And it feels especially important right now in the times we've been into. But for those of you who Many of you have probably read the Leadership Challenge or been through training around it. I'm going to talk briefly about each of them and highlight a couple of things I think are particularly relevant today. But they suggest our role as a leader, right, is to be the model, unify people behind a vision, keep challenging, aim toward continuous improvement, get things out of the way for other people to work, and then remind people why we're doing what we're doing all the time and carry that message forward. So the first is to model the way. Let me get these. Oops. So by modeling, what Cousins and Posner meant is we can do this by establishing principles and creating the standards of excellence for our people. What do we mean? What does it mean to be a role model? Where should we be day in and day out? Where do we set the example as ourselves as leaders, but also avoid some of those traps of things of getting misguided, right? We want to make sure we're the one helping set goals, small goals, creating opportunities for the team to succeed and do well together. And then finally, it's our job to create room for victory, making sure people know why there's success. One of the other things I like to work on with my direct report team is part of modeling the way is also being clear that there are traps. And I love the parable of the hungry ghost from some Buddhist teachings. And it's about the fact that, these ghosts are so hungry and they wail incessantly, and it's loud and it's disturbing and it hurts us, but they can't open up enough to be nourished. They can't take in enough, so they constantly wail. And when we continue to try to feed them, they're more frustrated that they can't take it in and wail louder. And it's this cycle of unending, ability to satiate and solve the problem. And so I say this as a way to model the way, which is also as a leader and something that helps, I think, build resiliency, is to step away from the hungry ghost and help our teams move away from the problems that are not open to be solved, or readiness for change. They're still in pre-contemplation, maybe. Where in the Prochaska and DeClement cycle are they? Are they ready for change? Do we have therapeutic alignment, right? Whatever it is, if you're not ready, then how do we need to step away from it and make sure that someone can actually receive our help. And as a leader, modeling for my team, we can walk away from that as a problem we can't solve. And I'm okay not being able to solve every problem. Then it's our role to inspire the shared vision. And that is about helping our teams see that the dream can come alive and that each of the people on our teams brings that vision forward. I think that especially during these challenging times, right, it's about making sure we return to that vision constantly. And sometimes the vision changes, but if our vision is to ensure that, one of my service lines is primary care, right? And so certainly our vision is to make sure we're focused on providing proactive health care, not always reactive. And the pandemic turned us into a reactive whirlwind. And really that constant battling of who needs a test, where are they going, what am I doing, is tiresome for a team whose vision is on keeping people healthy and well. And so how do we help them return to the vision of our job is keeping people healthy and well? And that includes things like how do they avoid getting sick, right? We put our efforts into some patient education and helping people before they need our care. That feels really good to the team who went into work in primary care. Also, we don't want them to get sick after we came out of shutdown, right? And all of you read the trends about nobody got their blood pressure checked or, did all the things they needed to do for their heart disease during the first year of the pandemic. So how do we make things accessible and safe? And that kind of creativity where we have, drive-through immunizations, get your kids caught up, or we'll do a blood pressure check or a glaucoma screening at one of our sites so you don't have to come into a clinic and be scared, sort of reinvigorated the fact that, oh yeah, that is our vision. COVID's not our vision. Pandemics are not what we came to do. And so getting through it meant we have to focus on what's the ultimate thing we came here to do as well. Challenging the process. This, and I mentioned it a little bit about role clarity, which I'll bring forward to you again to remember. But as the leader, the resiliency for me and for others is to say, in order for me to, get through this, we're going to decide what needs improvement. What stuff is there? Where are those change opportunities? How do I bring that to the table as a way to help my team and others around me not do things that aren't working as well, right? Try new things. So we want to search for the ways we can change, search for opportunities, make those possible to experiment with, clear the pathway for our team members to experiment and take some risks, take those innovative ideas from our people and try to make them have test opportunities to do it, accepting the inevitable disappointments as learning opportunities and knowing how to stop doing what doesn't work. This one's super hard. I work for a perfectionist organization, but you got to get off the horse when it's really dead. Thank you to my colleague Karen Nelson for that visual. But stop doing what doesn't work and stop doing what we don't do well. But the leader has to help us get there. It's okay as a team, as a group of people to say, wow, this just doesn't work. The juice isn't worth the squeeze, whatever sort of idiom works for you in this. But in order to get ourselves through, we're going to cut off what we don't do well, what doesn't work, and what we've tried 100 times and help ourselves move on. The next pillar is helping other people to act. And so in this pillar, what Kouzes and Posner focus on is how do you help build collaboration and get people together actively. So we want to help our teams rely on each other instead of always needing that sort of parentified leader, right? We're continually teaching how to build autonomy, build trust on a team, all those things you all know how to do about team building and getting your team ready to act. That's the pillar that Kouzes and Posner are talking about, where the leader isn't parent, right? The leader is facilitator of teams doing good work, or facilitation of people not on your team, getting people to help get things done by establishing trust, creating relationships. Social workers understand what goes into relationship building. Got to build a spirited team, do all those things. Even I've learned a lot of cool things people did during the pandemic to do team building. I heard there was a bread making Zoom or something. One of our the business office did. I was like, that was a long Zoom session in a kitchen, but they loved it. They had a great time. This mutual respect value is what creates people's feeling like they can act without fear. Where mistakes are okay, a place where we can try something, doesn't work, I have a team, and I can rely on members of my team to help me challenge the process and also act on the things that are really important to get done. And then last is encouraging the heart. And in this one, right, remembering that people, we go back to the beginning of our talk today, it's people who come to work. And people have feelings and emotions, and most people choose a line of work because it means something to them. And my social work colleagues can be idealistic in that all of our work has to drive ourselves towards some end that serves humanity, but also it's meaningful for people to come to work and know they're providing for their family, or they're busy all day, or they use their brain, right? So whatever that sort of meaningfulness is that we garner from work, celebrating that and honoring that for the people we know, and going after the accomplishments that are important to them, and understanding the contributions of our team members. How do they like to be recognized? Some people don't want you to share their name in a huddle, right? Or some folks really like when you just send them a handwritten note. Some teams are dying to go to happy hour when we're able to see each other again, or whatever surge comes and goes. So that sense of knowing each team has a little different need, approach, and desires, but it's important that we think about the accomplishments that are important to them. I challenge myself in that I oversee a pretty broad portfolio, and so accomplishments to me are not always evident at that day-to-day level of what's happening in a clinic. So I love to hear that story about the medical assistant who really was connected to a patient and solved a problem, right? That moment was so valuable and is the whole reason why we do this work. And I just don't get to see that stuff in sort of my work. The accomplishments I see teams create are when, a whole clinic stands up or goes down, whatever. And so being attuned to the fact that many levels of our work life exist, and how do we celebrate their accomplishments at each level, right? And a manager needs different celebration than a frontline team member, than a vice president. So one sort of statsy geek out, but I think really relates again to my resiliency as a leader, and the trap of what we get into is, for those of you who think about looking at your processes over time, right, and how things are performing, we know that processes are unstable, that stability is within a range, and that's to be expected, right? There are control limits, there's normal variation, and that when we get outside of standard, maybe 3-4 standard deviations, we decide there's cause to act, but within that range, the control limits, it's normal. I happen to work with a lot of people who, anything that varies off the mean by any point is cause for attention, but it isn't really, right? And we don't want a patient to have a bad experience, of course, and we should work through that individual and do service recovery and create that problem not to happen again, but it doesn't always need system intervention. So when we think about reacting and being able to have resiliency to get through the myriad things that are on fire, I like the visual of knowing, well, how far off the mean, how far out of normal is this really? And is this worth a committee being stood up to get something done? Or can we chalk it up to normal variation? We like to be closer to consistency every day and recognize we can't because we're a human system. And even in our desire for continuous improvement, where we want to keep improving, the mean wants to keep going up, we have to bounce around through it, right? We have to see the different components or the ups and downs. There is always going to be swing, even if we're headed in a trajectory toward the top. And for me as a leader, and for my leaders on my team, for us calling into question, is this worth acting, or is this someone's anxiety? Again, going back to the beginning, helps us have resilience into putting our attention into what's actually important. and will make a difference, because perfection can't be the enemy of progress, right? We can't stop and fix all the tiny little nuances if it's keeping us from progressing, or it's taking too much attention away from the good work that needs to get done. One of the tools for staying focused on this is leader standard work. Some of you may have heard this. It's kind of this lean tool around, in order for operations to run well, we have to have standard work, right? We don't want variation in how we execute on a process. We like to make sure we follow the same script, we collect the same data. That keeps us from having errors, etc. Leader standard work is a way for the leader to say, these are the things I do to stay focused as a leader all the time. This keeps me healthy, well, and keeping my team achieving the highest results, the things I think and they think are important. And so it isn't about, having to check a lot of boxes. And I think about leader standard work as, what kind of leader do I want to be? What are the behaviors that will show and will be a demonstration of the kind of leader I want to be and what I want to bring to work? And so we do this by things like, right, I use my standard work to create the standards for myself, challenge myself to stay focused on the things I believe are good daily, monthly, weekly, and how I want to be a good leader, and then helping my team use the same processes to do their work. We all have different kinds of standard work needs because we all have different jobs to do, and we all want to be leaders in different ways. A couple of examples, just a snapshot of my board, and then a friend of mine's board. But again, what kind of leader do I want to be? I want to be a leader who shows up, knows the work. I want to be available, responsive, and also I want to be comfortable, make sure that I'm healthy. And so the kinds of snapshot for me that make me whole as a leader are making sure I'm rounding. You could see 3 out of 4 weeks I didn't round that month. So I've got to create an improvement. I didn't get done what I needed to get done that month. Why is that? Doing my recognition so people know I'm paying attention. My linked checks for different areas, like, am I really available and coaching the leaders in the work that they want to get done, every day, every week, every month, etc. How do I help them? And then making sure I have work time. I circled this on my friend's chart about having think time, having strategic thinking time, because one of the biggest, I think, threats to resiliency as a leader is, as I mentioned before, not doing the work that we set ourselves up for, the job we took, right? So if we go back and think about all the variation that exists in that run chart, those are all little fires that we can get called upon to deal with. There's always something happening in the leader's life that could use attention, right? But it's kind of a black hole, and it's a trap. And those little fires will burn, and because operations are not stable, and there will always be something that's imperfect in our human operation and human caregiving organization. So spending all of my time reacting to every single fire or inquiry isn't ultimately helpful to my system getting better, to me as a leader. And it's a super drain to not be able to do the exciting work that drove us to this work. Something my team really continues to expand our integrated behavioral health model, and we're not a closed system, so it has a lot of interesting complexities to it, but you can keep pushing it off because it takes this attention, but strategically, that's actually the driver and something that will promote resiliency for me and my team as we keep making progress toward making the vision come alive, right? Which is about helping people stay alive and healthy and resilient in their primary care medical home. So I share this also as this reflection that when there is crisis, and if it's contained to a period of time, which the pandemic has been 2 years of crisis, how do we step ourselves away from the crisis to make sure we're still doing the things that make us whole as a leader, the things that bring value for post-pandemic life or peri-pandemic, whatever we're going to call it, and moving through it. That we've got to make sure part of our time is devoted to the long haul. And I love this one because for me, it is also that reflection of, if there's so many tiny little things getting done and we keep putting them all on our to-do list, it takes forever to get anything done. So that level of focus, clarity around what is strategic for me helps, again, my resiliency. Nobody feels great about the 40 things on their list they can't accomplish if they want to get one thing sort of across the finish line. I'm gonna put our Q&A time together too now, but just wanted to say thank you so much for attending today, and just this sort of wrapped up, sense that I'm thinking back to what really helps me as a leader stay resilient through has been a slog, is a refocus on who am I as the individual, where am I in the system, and then how do I keep doing the things that keep me whole as a leader and bring those to work every day with me. So really happy to have some conversation now in Q&A, or Kara, whatever you say, however you say we should run this.
Yes, thank you so much, Tim. There are a couple things in the Q&A. Tim, I'm not sure if you can see that or not.
I will open the Q&A, sure.
The first one I can answer, they're asking about the vision board slide. So everyone who attended will receive a PDF version of Tim's presentation. So just hold out for that. You should receive it a little bit after. Someone, Jessica, thank you. She said, do you have any suggestions on how to handle that in the moment? She said that getting stressed, especially in intense times, can be very reactive.
Yeah, Jessica, that's exactly, I think thank you for sharing what we feel. That's why I started with sort of that exercise of breathing, because what helped me was prepping for it in advance. So my sense that, going into something I knew where people were going to be anxious, if I can center myself before I get there, and if you're facilitating a meeting where I knew there would be a lot of anxiety, I've also been happy to start the meeting with some breathing or refocus or a minute of quiet before allowing any of those people to start yelling at me. It sort of disarmed it a little bit, and brought down the temperature. So my recommendation was about, centering myself before going in, knowing what my trigger points might be, and, once in a while, turning off your camera to roll your eyes. Anybody else? And please, the other thing you could share in the Q&A is maybe a resiliency tip that I didn't share today that you would share with your colleagues here on the line, or something you really learned worked well, or you were taught yourself this year. All right. Well, I also think Kara will probably share my contact information, and I'm always happy to connect with folks, email or LinkedIn, or you can even pick up the phone and call sometime.
Perfect.
Really grateful to have spent this hour with you. Thank you, Susan and Kara and CSE, for the opportunity.
Thank you, Tim, so much. We really appreciate it. And thank you to to everyone who was able to join today. I know a couple folks were interested in sharing the recordings that will be up on the CSC website in a couple days, and I'm happy to share that link out to all of you once it's up. I will be putting in a link to our survey in the chat right now. So especially if you are interested in getting CEs for attending, make sure that you fill this out. If you're not getting CEs, we would love for you to fill it out anyways, and we appreciate your feedback. Once the session ends, you'll also get a little kind of pop up on your screen where you'll be able to take the survey as well. But again, I think that's all we have. So thank you so much for everybody for joining, and enjoy the rest of your day. Thanks all.